there was a purpose for this satellite. It was to call for action on this, and to give the call for action. We have, for voluntary medical male circumcision, we have a man who's had a long and distinguished career in international affairs, working on behalf of the poor, and in addressing environmental and humanitarian issues at the United Nations. His Excellency Benjamin Mkapa was the president of Tanzania from 1995 to 2005, and he is well known for his efforts to eliminate HIV, and he founded his own foundation, the Benjamin Mkapa HIV/AIDS Foundation, and he joined with the Champions for an HIV-Free Generation in 2008, and his focus has been on ways to sustain funding for HIV prevention in sub-Saharan Africa. His Excellency Benjamin Mkapa. I think you're fine if you just put it on top there. Yes.
Okay, thank you. I am the last speaker in the evening, and you must have...
Let me make sure that, just to be on the safe side, I don't think that's it, but just in case, all right? Okay. Thank you.
You know, my children say I am the BBC generation, born before computers. So all these things confuse me. As I said, I'm the last speaker, and I know it's been a long day. I hope to take not very long, largely because I'm supposed to make a call for action. Every one of the speakers this evening has been making a call for action. I stand only to underscore that call, and particularly with respect to the SADC countries or the SADC region. Sub-Saharan Africa, yes, but especially the SADC region, which I know better than the other areas. I believe that now we have come to understand that the HIV/AIDS is an epidemic, a pandemic as we call it, and we are the epicenter in the SADC region. Over the last 30 years, efforts have been made to find a cure, and we're always running around looking for cures. But there are diseases that are preventable, but we don't produce enough balance in our efforts between the balance to find cures and the effort to prevent. This is especially true in dealing with the AIDS pandemic. But now we have heard there is one preventive method which is 60% able to reduce the incidence of infection. I hope that this will rouse us now to a little more effort in emphasizing the role of prevention in HIV/AIDS. Why must we do this? I know there are reasons of culture, reasons of economy, and so on. But for me, as I listened throughout the speakers, the major thing is that it is less costly than any other method. On balance, it's less costly than the cure route of dealing with this problem. Minister Oginga has told us very, 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 very vividly what the costs are involved. So that is enough reason. But the greater reason is that it has been scientifically proven. And we have heard the statistics here. I know there is a question whether how random it was and how controlled it was, but I believe the science, it is really capable of inducing a 60% reduction. It is not forced. It's a method which is not forced. It's voluntary. So we can't be accused of being dictators or anything like that. It is effective, as I've said, 60% we've been told. It is not a Western imposition. I know we are very sensitive about our sovereignty and our ability to decide things for ourselves. The research may have been done by Westerners, but the results have not been concocted by Westerners. But what is more, they have been proven and authenticated by African scientists. So this is not a Western imposition. It is not very painful. I say very painful. And in order to clear any doubt, I was circumcised 60 years ago, long before AIDS came along, without any needle. So it is not very painful. Another reason why we should not hesitate to go for voluntary male circumcision. And it's undertaken in circumstances where there is enough counsel to soften the fears of even parliamentarians, as the Honorable Chairman has told us. All these are good reasons why we should scale up, and that's why I'm making that appeal for scaling up the voluntary medical male circumcision. What must be done then? The first thing, and I was fortunate to attend a session before this one. The first one is for governments, which are really the standard bearers of their national policies, to design, organize, and get a consensus or a vision on a health policy that tackles HIV/AIDS openly and accountably. That they must be prepared to do. You know, we discuss these issues as if they were part of shame, but they are not. They are a very serious developmental problem. If you have a little earthquake and a couple of houses are broken down and 2 or 3 deaths are done, you have a national mobilization to find funds, goods, and so on to deal with this problem. But here is a pandemic that kills thousands every year. And we don't get as stirred up as we are when a little boat sinks, or the earth moves and buries 120 people. We should. So that's the first thing. Let governments assume now a vision and understanding of the kind of even human life damage, let alone the general developmental damage that is undertaken by not taking this matter very seriously. But there are other reasons. Treatment is extremely costly. I can only speak directly of my own country. 2/3 of funding for HIV/AIDS is provided by international donors or partners. 2/3. But 2/3 of funding for health in the country is provided by our own resources. What does this show? It shows that we have a dependence on external resources when it comes to a major pandemic in our countries, and yet we do have the capacity for a general health service. Produce a balance. We can do it. So the first thing is to have a policy and let it be, its evolution be participatory. Get everybody involved and then articulate it and then explain it and then mobilize the people, the ruling parties, the opposition parties, the civil society organizations, the NGOs, because you are dealing with a national pandemic. That awareness has got to be inculcated in our people. So I'm making an appeal that effort should be made. We have one in our country, we have a policy, we have an agency, we have a lot of room for public-private partnership. The MC has said about my own effort to join that campaign, but it should be broadened so that others can be brought on board. Ownership first. And then actively try to find a local, national base for its funding. It can be done. I'm not being trivial, you know. I have seen African delegations to all kinds of meetings, not the AIDS Council, but these other political meetings, week after week, in their 30s and 40s. Why can't we devote a quarter of that into this death-inducing threat that we face? I make a special appeal to the parliamentarians, councillors, so governments and leadership at the center, but also in the regions and in the districts. We made this plea in Abuja that 50% of the national budget would go into health. My own country hasn't. I think we are 12% now. I have health people here who know. 12% of the budget. But there are others who are still at less than 10%. That is wrong. If you don't have a healthy community, a healthy body, how can you develop? You can't develop your mind, you can't develop physically. What is the other thing? The next thing you do is to mobilize the external support. But again, make sure that the external supporters, partners, or whatever you call them, come in to help and partner with you with respect for your ability to understand the problem, to devise a solution, to execute its implementation. They must respect that capacity. Otherwise, they will dictate to you, and this will not be a program of dealing with a problem which you own yourself. I attended the program again, an address by the Minister of Health of Ethiopia, dealing with country ownership and how to make it effective. He said, we do not deny external assistance. In fact, we welcome it. The only condition is that they must respect that this is our problem. We know our cultures. We have designed the ways. They can help us design them better, but they can't be a substitute for ourselves. That's what ownership is about. So that is my plea. Finally, not finally, but I really have spent too much time. Finally, I want to say this: openness and advocacy. Openness and advocacy. We discuss these issues surreptitiously in Africa. It's taboo. It's wrong. To sympathize with a relative I have lost through HIV/AIDS does not mean that you must come and whisper to me, sorry, Paul. No. We must be able to discuss these matters openly. We can do it with dignity also. But it must be discussed. Otherwise, we'll be burying ourselves in the sand, and we won't get very far developmentally. So, when you have discussions, whether it is on politics, in culture, in football, in beauty contests, put in a word about HIV/AIDS and voluntary male medical circumcision. Put in a word. I hear these discussions on the radio and television every other day by people who say they're experts, they don't know a thing, but they will discuss these subjects until you're bored stiff. Get the people who are working in the field, who are designing these projects, get them to discuss, let them assess, not just give views, let them evaluate, not just air their observations. No. That way we'll get the real size of this problem and maybe get a little more light on the solutions that are being proposed. But on this one preventive solution that has been given to us this evening, there can be no question at all. It can help to bring about an Africa which is free of HIV/AIDS, a truly free generation of HIV/AIDS. It can be done, as my founding president would say, it can be done. Play your part. Thank you.